A year after what officials deemed crisis-level staffing at Austin Travis County Emergency Medical Services, the agency still grapples with a nationwide challenge of hiring and keeping medics.
In recent months, EMS has taken new steps to address staffing and ease the pinch, but they warn that the problem could persist for months to come.
The KVUE Defenders looked into what that means for people in medical emergencies. Here's senior reporter Tony Blahetsky.
When 30 new cadets graduated from Austin Travis County EMS training in September and another 29 this spring.
Congratulations, everyone.
Officials celebrated not only their accomplishment, but a new crop of employees to shrink what they say has been a challenging vacancy rate.
Our medics really had a lot of traumatic experiences during the pandemic.
In the months after the worst of the COVID-19 pandemic, EMS struggled to keep enough medics in the job and on the street.
It's been really bad for a lot of reasons. We see assaults on the rise on our providers. We also see our call volume rise a lot because of the number of people that are moving here. Austin has become deeply unaffordable for our medics. Our salaries have not risen commensurate to the way that people's mortgages and property taxes and rents have risen.
The KVUE Defenders reviewed months of staffing records obtained through EMS, which showed that from June 2022 through March, vacancy rates reach unprecedented levels, above 20% each month, reaching as high as 25% 1 year ago this month. That shortage is part of a well-documented national issue after the high burnout COVID-19 pandemic that Austin Travis County EMS Director Robert Luckritz has watched play out in his department.
This is a national issue, is something that is on a catastrophic path for us as a nation to look at. How are we going to continue to staff ambulances?
Texas lawmakers in 2021 also passed a $21.7 million effort aimed at medic training and recruitment statewide through the American Rescue Plan Act. As a result of staffing issues in Austin, EMS required medics to work overtime, fueling feelings of job fatigue.
It's one of the straws that broke the camel's back for me. Had staffing been at a reasonable level, or I would have stayed.
And causing some medics, such as Aaron Ruiz, to leave this summer after 9 years.
Having our morning coffee before the calls come in.
Of what she says was a fulfilling career.
Our last shift together. It started to affect my health, my physical health. And it took that to say, and my husband saying, you know, like I can see it.
EMS officials say they have recently put new steps in place to address the key issue that Ruiz says caused her to leave.
We've made some amazing strides towards bringing us to full staffing.
Luckritz says that the city has given EMS permission to have 2 more cadet classes a year with 30 to 40 students each, making up the turnover of the average 1 medic per week departure that the agency generally sees. EMS officials also have cut a requirement that some medics work mandatory overtime, which many say cause long-term exhaustion. Now, if an ambulance does not have staffing, it instead closes for a shift and nearby units respond. And the department, through contract negotiations, began hiring medics from other EMS systems without having to go through their own training program, putting them on the street faster.
As we look ahead, we're seeing light at the end of the tunnel.
Records show staffing vacancy levels decreased to 17% in July and August and 15% in September. Luckritz says ambulances are available if a person calls 911 without delay. And he added that response times for life-threatening emergencies have held steady over the past year for more than 130,000 calls, despite the staffing struggles.
I hope to see by next year that our staffing will greatly improve based on the efforts that we put in today.
Selena Chi, president of the Austin EMS Association, says she remains hopeful that new efforts put in place by EMS will continue to ease the shortfall, improving morale of existing employees and helping recruit others.
I am optimistic, yes, and I really look forward to a time where it feels like we have some more stability so that we can focus on some of these other programs that improve morale and improve satisfaction about the job.
Here's a few of the ones I have had printed. So this is the one with me and my Class A's.
Ruiz, who now trains medics near Waco through a government grant-funded program, says that as EMS works to address staffing, she would one day consider returning to the job she loved.
So many memories, so many giggles, you know, just a lot of good times. I do love the human aspect of it. You're helping everybody. Every single call, you're helping someone. It's a very gratifying career.
The EMS chief says that he believes with all the measures the agency has put in place, it should have a vacancy rate in the single digits within the next year, marking a full recovery within the agency from the COVID-19 pandemic. For the KVUE Defenders, I'm Tony Plahetsky, KVUE News.